spine's not moving very well, having someone put a hand on the side that's not moving very well, say breathe into your hand or breathe into my hand, try to expand through the rib cage, strengthen your respiratory muscles. We even talked about using a TherBand around the rib cage and inhale, breathe out, try to expand through the ribs. So those are some easy exercises that you can do. The inspirometer or incentive spirometer, we talked about that previously. You're inhaling, trying to keep the ball at a certain level as high as you can and maintain it. And then I have on here blowing cotton balls through a straw. You can have a little race on a table. Yeah, you can put some cotton balls or something down, and then you're blowing through a straw. A nice slow sustained breath and try to blow the cotton ball. See if you can get it as far across the table as you can.
What about ping pong table size?
Ping pong table, yeah. You can use the ping pong balls. Try to get them into a cup down at the end of the table. Oh yeah, anything like that. You know, it seems silly, but it's an actual goal. It's an activity. You're trying to get somebody to do something. I've had more than one person lined up and one on either side of the table and blowing them back and forth at each other. So it's something that's a little more engaging than, oh, we're going to do exercises. We're going to play. You know, we're going to play this game. We're going to do something that's of some more excitement than just exercises.
That's usually cute. I'm going to say, smell the roses, blow out the birthday candles.
So the blowing the cotton balls, that's a person with breathing exercise.
Yeah,
Just trying to get them to slow down their exhale, get a nice full exhale. Not forced, because you can't really blow very forcefully through a straw. It's more of a slow, sustained exhale. Okay, so on postural strengthening, as I mentioned before, a lot of crossover with our other spine exercises and our scapular stabilization exercises that we're going to cover in the next section. And I didn't necessarily list basic, intermediate, and advanced on these either, because all of it can be progressed from basic to more advanced. And I don't want to just really label any of these any one certain exercise level. So I mentioned last week about the turtle head, doing your posture check. So wherever you are, make a ring around your face. Okay, can you pull your head back like a turtle? Can you retract your head if you can? I mean, your head's been pretty forward. Okay, if I'm in good posture and I'm here, I don't really have much room to pull. Okay, so that's a good check. Good posture check. All right, turtle head, can you pull your head back? We've got our ABCs using your nose in supine. So we didn't do that one in cervical, but we've done the ABCs with your foot. We can also do the ABCs with your neck. So if I'm in supine, I'm going to do a chin tuck, and then I'm going to try to use my nose to draw the alphabet on the C.
Yeah, then your middle, your nose is a pin,
I have a pin,
and you're going to write
just like we did with our foot.
small letters.
You don't have your head off the table though?
Head's not off the table. Head is supported right now in the chin tuck. Do you ever work the head off the table? Do that for
No, the progression is to have them sit upright to do
Yeah.
it, with the head supported.
So
No,
head
this is
here.
where you start.
This is basic. This is pulling me into good position. So I have to be in a good position here. Gravity is making me. Okay, so I'm doing my ABCs here. And then everything with our posture exercises, if we are in supine, the spine is supported, that's more basic. And then we always want to work up to more of a seated posture. So then we can work, as Brian said, try to do. So we're trying to keep the chin tucked, and I'm spelling out my alphabet on the wall.
And then the advanced progression is to have them put their forehead against the ball and lean against the wall and do it. And that's beast mode.
Yeah. Yeah, and if you ever get a patient at that point, record it and send it to us. Let us know.
I've seen it done once.
Yes.
It's pretty wicked.
Okay, so pelvic positioning in a tilt or a tripod. So sitting on the sit bones. I mentioned that earlier. Whether you're just on a firm surface or if you're on one of the more unstable surfaces, obviously more basic is going to be just sitting on a chair or a firm surface. But you don't want to sit back on your pockets. Okay, sitting back on your pockets puts a lot of strain on the low back. And as you're talking about in ortho, it's like a jelly donut there in between your spine. Your discs are getting compressed anteriorly, and that jellies want to poke out posteriorly. So you're putting a lot of strain on your disc. Exactly like that. So we want to not sit on our pockets. We want to sit up on the sit bone. So find your sit bones, and you have almost like a tripod between your pubic bone and your two ischial tuberosities. Folks should be up on their sit bones, on their tripod, their pelvic tripod. So you want somebody to assume that position and have some weight in their feet, that they're not just rotated and sitting back on their pockets. Okay, so find your tripod. Sit up nice and straight. Sit on your sit bones. When you're in a chair, make sure you're seated all the way back in the chair, that you're not scooted forward and leaning back on the back of it. One therapist that I worked with always said, put your crack in the crack. I'm not going to tell the president of University of Oregon that, but yeah, whatever. So sit all the way back, so your backside's all the way in the back of the chair. Right. Choose your audience, I'm sure. Wait until you have a good rapport with somebody to tell them to put their crack somewhere.
The
So,
heck?
yes.
I like that.
Yeah, so find your tripod, because that's where you're going to be most balanced. So as part of our progression, we'll get into, go ahead and just slouch back onto your pockets, like I normally don't have people do. And now if you're slouched, now try to lift one foot up off the floor. Now come back up to your tripod position, nice and tall, and now do the same thing. Is there a difference?
It's hard to slouch on these.
Hard to slouch? Yeah. So if I'm in an upright position, I have better postural control. I'm in a more stable position. If I'm rotated and rocked back, I'm in this weird slouch and I don't have nearly as much control of my legs. Okay? So when we're on the ball, that's a more advanced exercise than on the table. So I'll oftentimes start with someone just sitting on the table, sitting on a dining room chair, and work on sitting in that tripod position, and then progress that and say, I want you to do a march, holding that tripod position. And typically we're doing a kegel as well, so we've worked on some trunk and core first. Now I'm having them in the posture, holding this position, doing a little march with each leg, and trying not to shift off to the side. Okay, if you don't have good trunk control or good strength, you're going to rotate off to the side to unweight to lift the leg, just like Trendelenburg. So I'm going to shift away and unweight this foot so I can lift it, shift away, unlift the foot. We don't want that. We want you to be in a nice straight posture. Okay, so I'll have someone do that just on the table, and then maybe work them to a disc, and then up to a ball, and we'll go through some more ball things here in a few minutes. But trying to sit on your tripod, sit on your sit bones. You don't want to be rocked back under your pockets.
So can we use like tripod 5 minutes for documentation?
Sure. Yeah, if that's an acceptable exercise nomenclature in your clinic, absolutely. You can, if they don't use that, then you would just say, seated pelvic positioning times 7 minutes.
What about this one?
This one, yeah, we know what it is.
Okay.
We know it. Okay, so we talked about the rib raise before as well. So as Brian was talking about with your positioning and trying to breathe and trying to move, if your thorax is really kyphotic, it's not going to allow you movement, it's not going to allow you to expand your lungs, it's not going to allow you to lift your shoulder. And when I'm down here in this position and I'm rotating my head, I'm getting a lot of excessive wear and tear through my cervical spine. So just by lifting the ribs, so I'll tell people, I want you to lift your ribs, I want you to lift your sternum. Inhale, lift, now hold it there as you exhale. And then try to leave it there for a minute. So inhale and exhale, but keep your ribs lifted, keep your sternum lifted. I'll use the string at your sternum method. I will put my hand over hand on the patient and make sure that they're not cheating when they do that and they're not doing this and actually getting lumbar lordosis, that they're keeping their lumbar spine still and lifting and extending through the thorax. Okay, so this is what you're doing right there, Patrick. You may need to cue them at their lumbar spine, but they're not moving through there. And sometimes I'll just scoot them all the way back in the chair, and that will keep their lumbar spine still. And your goal is just to lift through your ribs, lift through your sternum, and try to do a rib raise. And I'll challenge people to do that 1 minute every hour. So again, when that watch goes off, at your 1 hour beep, rib raise time. So doing it multiple times through the day. These aren't typically exercises, if doing them twice a day for so many repetitions is not quite as effective, I find, as doing bouts all through the day. Just doing a couple of things all through the day, every hour if possible, because these are things you're gonna have to keep carrying over through the day, not just my strengthening exercise, home exercise program. All right, so again, we can do the rib raise, we can do the tripod on your unstable surface. So if you are on the ball, let's go through a little progression here. So we talked about getting in the tripod, and even if you're not on a ball, find your tripod, get in a good position. It's going to be harder on the discs, BOSU on the balls, but tripod, muscles are on. Try to lift 1 foot, back down, keep the pelvis level. I'll put someone in front of the mirror doing this if they have a full-length mirror at home. This is a great one to do in front of the mirror because you'll see that little shift through the hips as you go through. So you want to try to keep the hips nice and level. So a gentle march. If someone can't do the march, I'll have them stay put and just lift the foot and extend the knee instead of the march. So it's a little more control than the actual march because you're not doing the hip flexion and extension.
When you're on the ball, how and doing the march, you want to have how much of bend do you want to have your knees? Do you want to have them more like that, or like totally?
A normal position as if you were sitting in a chair, like we were talking about earlier, that your hips and knees are around that 90-90 mark. They shouldn't be way underneath you. They should be about 90 degrees. Okay. You can add in some arms. So as I lift one knee, I can lift the contralateral arm. Starting to get a little trickier now.
Alright. That works.
And when you really get control, you can lift the same knee and same arm, so it's lateral. Okay, so that's just a simple progression. It's not a progression someone's going to go through within 1 visit. Nobody gets to that same arm and leg on the very first visit. Usually it's just trying to hold position and just do the knee extension or just do a hip flexion. And someone will go home with a ball, and that's what they're going to try to do, is to sit on this or a disc and do a few sets of 10 or so. But park them in front of the mirror if at all possible, so they can see if their pelvis is doing this little slip to the side as they're lifting. So very simple progressions that you'll see used pretty regularly. So it hits the core, you're getting a lot of trunk control, and again, generally you've talked to somebody about Kegels first. Maybe you've gone through a little bit of pelvis positioning and finding your correct posture to make sure that they're in good posture when you sit down on the ball. But I like to bring people out to the gym in front of a big mirror where they can sit and look at themselves and go, oh, how come every time I go to lift my leg, I shift off to that side? And I say, it's just the combination of muscles. You have to engage these muscles so you're holding yourself and lifting and not doing that big shift every time you go to move. And it takes a lot of practice. All right, Brian's favorite exercise. I don't know.
I don't even know how I came up with this. I was working
I
at
don't know
a
either.
nursing home a long time ago. And, you make a lot of these adages, breathe, smell the roses, blow out the birthday candles. And so one day I was working with this lady and I just thought, this is what it needs you to do. It's kind of like saying, I don't know. So basically what it is it's for some, when you're working with elderly folks and you want to get them to breathe better and use their, reduce pain on their mid-back a lot of times. So what I'll have them do, instead of having them just reduce excessive thoracic kyphosis and pinch their shoulder blades, I'll say, I want you to kind of do this I don't know pose. And it is not just doing external rotation of the shoulders. That's not what this is. Okay, so you have to be really careful and watch to make sure they're not just doing this. It's actually doing the motion and pinching the shoulder blades as you reduce the excessive thoracic kyphosis. So you're going from this position with your hands kind of like you were holding a tray, and as you rotate into external rotation through the shoulder, you're pinching to perform scapular retraction, and you're doing the rope raise at the same time. So you're going to this, I don't know, pose. But that's kind of how it looks when you end. That's why I call it the I don't know exercise.
But
So-
we're not doing this. No shoulder elevation.
No shoulder elevation.
It's not, I don't know.
Here's this rotation. So you kind of have this, I don't know, and then the progression is, you kind of have more band. And then you have to go to the and then just work on pulling out. You know, I'm doing external rotation, but I'm also performing scapular retraction as I do this.
We're gonna hit that again with scapular stabilization.
Oh, okay,
Because
there
again,
I'm jumping
it's
ahead.
all crossed over. No, that's perfect.
I don't know.
It all crosses over. Everything comes together in this course. And then, staying alive. Ha, 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 ha. Staying alive.
This one came from working with a dentist, I think. He was a dentist or a dental hygienist. And he was slouched over all day and just would come in. And he looked like an 80-year-old man. He was like 35. So I said, here's what we're going to do. We did the basic progression where I had him work on his posture, you know, pelvic tilts, scapular retraction, chin tucks. And I said, what I want you to do is I want you to stand against the wall. I want you to really get a good posture alignment. What I want you to do, this kind of adds a little progression because it's a little bit more dynamic. But what I had him do is I had him reach into shoulder flexion, abduction, and external rotation with one hand, like I was doing staying alive. And then the opposite hand goes into kind of an internal rotation, a little bit of extension of the shoulder, okay? So that you're kind of doing this, and you're doing this against the wall. But you have to maintain your core and your posture. So you're kind of doing this. Well, staying alive. So you can do it against the door frame, or you can just do it, you know, sitting down. But basically it kind of works on some of that scapular retraction, scapular depression, and again, it facilitates going into thoracic extension. So it's a little more fun, staying alive.
It's fun and functional.
Fun and functional.
Fun and
Aren't you ready for Saturday night?
That's right. I reached back to grab my seatbelt.
That's true.
You gotta do that motion. So
Little lawnmower.
that opens us up. That's right. Eat first, party later.
That's right.
We'll do. I'm
We
gonna
got that.
PNF this term too, so we'll get a little bit more of that later.
Not done
For
yet.
now. Nice. Alright, so one thing you can do is a door frame tracing. So if you think about sitting or standing inside a door frame, reach up towards the door frame, you're going to trace it with your hands out and down. And you're almost going to think about when I come across and down, I'm putting my shoulder blades into my back pockets. So you're doing that depression and retraction. So I'll just have patients think about being in the door frame, whether they're sitting or they're standing, and give yourself a nice stretch, up and out, and get that nice pinch together. So that opens up the chest, because when we're in that forward head, rounded shoulders, we get tight through the pecs, we get internally rotated at the shoulders, so pecs are really tense and tight. We're stretched out through our scapula, our posterior muscles, which we'll cover here in a couple of weeks. So this is going to just reach up, out, and down. So as you come down, you get into your chin tuck position, your elbows are down, your shoulder blades are tucked in your back pockets, okay? And then they're back where they're supposed to be. So then you can do the same thing as Brian was showing with the I don't knows. You can then use a band, so you can hold the band and do that same motion. So you add a little resistance to it. Initially, I just use it more of a stretch or a range of motion and a cueing position, and then as we need to, then we can add the band to make it more strengthening. All right, so foam roll or towel roll, we'll come back to that one in just a second because we want to go through the whole thing. But a posture correction against the wall, so I mentioned that previously with lumbar spine. And so what Brian was doing in the door frame as well was getting you in a good postural position. So put somebody against the wall, head, shoulders, everything against the wall, and then have them walk away. And try to maintain that position, maintain that posture as they walk away. Because the wall's always just a nice, available vertical surface that you can back up against and use as your cue.
Yeah, it's a
Do you
nice
want-
tactile cue, they can kind of feel the contact from the wall and then use that as a reference.
Do you want your heels in contact, or you
Heels
want?
are not gonna be all the way in contact.
Because you want to push your lower back against the wall, right?
Exactly, and most of us have a little
Yeah.
structure right here, we like to call the big house,
Yeah.
that's gonna stick out more posterior than our heels.
True.
So if your big house is up against the wall and you pull your heels back, that's gonna put you in a lumbar lordosis.
Okay.
So if you back up against the wall, your heels are gonna be, probably 4 inches or so away from the wall.
Okay.
So you're leaned back against the wall and then you come forward. And then that brings up a little bit of, in your chapter, they talk about postural sway. So we talk more about that as far as a balance is concerned. But if you're in that backed up position, we covered, there was a question in, I think it was on the ankle or gait or something like that last term, where if you are lowering yourself against the wall, what muscles are working and how are they working, and then if you pull yourself away from the wall. So if I'm against the wall and I'm in my posture, my feet are slightly forward, I'm having to contract concentrically my dorsiflexors, so my anterior tibials, my shins, they're contracting to pull me away from the wall. And if I'm lowering back against the wall, I'm eccentrically lowering myself. And this is a balance strategy for us. So if we're in good posture, when we start to lose our balance and we tip backwards, our shins are gonna be, our lower extremities are gonna be the first line of defense to try to pull us back. Our ankle strategies gonna pull us back. If we tip forward, our calves are eccentrically lowering us forward, and then they concentrically pull us back. So that's part of our posture as well. So if someone doesn't have good posture, sometimes it could be a balance issue. So that may be something that we work on. So we'll talk a little bit more about that at another time next year when you're covering balance. So think about everything that's involved, and if someone has any issues, you may address different things. And then I mentioned visual cues. So feedback for correction of posture. Most people don't know they're in a bad posture. Some people do. It's okay. Some people know, I'm just always slouchy. Some people know, but most people don't exactly know what is going on. They don't know what this is normal to them. They've always been like this, or they don't realize it. So putting someone in front of the mirror and pointing it out to them is fantastic. So yeah, you tend to have your head tilted to one side or your shoulder is lower. All right, when, again, you get up in the morning and you get dressed and you get ready, look at it. Okay, am I in the right position? Try to find that position. And it's gonna feel weird for a while, because if one shoulder is rolled forward and we're trying to get that shoulder rolled back, it's gonna feel like, man, I'm working really, really hard on that shoulder. It can't be level, it can't be even, but it actually is. So, but it's gonna feel different. It's gonna feel asymmetrical to them because one side's having to work harder. So giving visual cues, giving tactile cues, that's gonna be huge for postural correctness. So keep that in mind. And again, when you document that, that's gonna show your skilled therapy because you're having to give them cues to get the desired result. So definitely document lots of that. All right, so on my note here, nearly all previous cervical and thoracolumbar exercises will help posture. We can do our stabilizer for the cervical spine and the lumbar spine, and then our quadruped, upper and lower extremity lifts. We've not done those, so I do want everybody to do those before we get on the foam roll. So with our spine population, we tend to do a lot of spine supported, torso supported exercises first. Then we go into more unsupported. So one of the very common exercises that you're going to see, similar to sitting on the ball and doing your marching and then doing your arm movements, is getting somebody in a spinal alignment position here in quadruped, and I'll demonstrate, and then I want you guys to do it as well. But your chin is tucked so you're in good position, so you're not looking up here. We had talked about the cat and camel stretches before, arching and lowering. I usually have people do that first to find their mid-ground, their middle, normal neutral spine. So once they find that, and mine's going to be all over the place because I'm really, really sore, but having somebody hold a position, raise a hand to lower. And so you shouldn't have somebody falling over. You shouldn't have them leaning really far to one side or leaning direct to the other side. You should be able to reach. If someone's tight through their thoracic spine, their pecs, they're not going to be able to reach very high. That's okay. You can have them reach with an arm, again, keep the chin tucked, keep a good position, have them reach a leg. I have to unweight slightly, but you shouldn't see me sway over to the side. I will oftentimes put something on their back, whether it's my Kleenex box, my Dynadisc, I might have like a broomstick type dowel rod, something like that, so I can hold them. Say, all right, don't let it move, don't let it fall off. They're not arching their back, they're just coming into an extended position. Okay, so hold it still. Okay, then they can work up to opposite arm and leg, so muscles are on, I'm engaged.
Hold it.
Don't let it fall off,
Nice.
and slowly lower,
Good.
engaged again, get settled.
Nice.
Okay, but again, you don't want to see the arch through the back. Okay, so that's a pretty common exercise that you'll find people doing. What's on me? Is that a foam roll?
I'm trying to show them. Usually we use the yardstick or something.
Yeah, use something. You
That's
could
a little
do
too stable.
something lengthwise along their spine. You can do something crosswise. So just something that's light enough that it will move a little bit. So Kleenex box it at home tends to work pretty well. So that's an exercise progression that you'll oftentimes see. So I want everybody to try that, and then we're also going to try a foam roll here in a second.